Hi guys, hello. Hi to everybody on YouTube, Facebook and LinkedIn, and of course to you lovely people on TikTok. Hi Gemma. Hi. Oh, good to see you. Oh, that's really good. I'm encouraged to know that is somebody I know that's actually the first person to join the live. Hope you're having a good Sunday. Hope you're having a good weekend. Right, so hi to you guys on Facebook, LinkedIn, TikTok, and YouTube. Right, it's been a very long while since I did a live stream, so excuse me while I gather my thoughts together, but it's good to have you here. Thank you so much for joining. Probably a pretty quick one. We've got just 2 questions we're going to tackle in today's session, but guys on TikTok, so you might not be able to see the visuals that I'm going to be showing to the other group, but if you can come over to YouTube, you'll get the full advantage. But it's great to have you here or wherever you're watching me from. But we've got 2 questions that we're going to cover today, and I think you're going to find them really interesting. One is around fat shaming in medicine. We'll cover that that will be the second question that we'll look at. And because the first one has a little bit more detail and a bit more information to share, so we'll do that one first. And that is around somebody who sent in a question about her pregnancy status and the fact that she's got fibroids and her concern about the placenta. So we're going to be tackling both of these questions this afternoon. I hope you're doing well. I hope you've had a good weekend getting ready for tomorrow. We've been really, really hot for a while. I'm actually glad that the weather has cooled down a little bit today, just so that we can take a bit of a break from the hot weather. But yeah, I hope it's been great from where you're watching me from. Please let me know where that is in the comment section. And of course, I would really appreciate if you give this video a like, if you share it with somebody who you think might find it useful, come and join in. So as we always do in this conversation, as I always tell you guys, this is, I'm not providing you with specific medical advice because I am not your clinician. Did I introduce myself? I don't think Gemma, I blame you. I didn't introduce myself. I got carried away. Like I said, it's been a while since I did a live stream. So of course you can see from the title down at the bottom, my name is Dr. Sylvia, but I'm a general practitioner and I'm based in the United Kingdom. And on our platform, we talk about different aspects of women's health care, sexual health, and of course, it does relate to family and children's health. And men are not left out, even though I say women's health, we talk about everybody, but you're so very much welcome. So the point I was trying to make was, let me just check out this comment and make sure that I am audible. So this is from Ms. Moore, watching from Toronto. Thanks for the information. Hi, thank you so much for joining. I appreciate you checking in from Toronto. What's your weather like over there? Usually I share a disclaimer before we go too far into the video because I want to explain that while I'm providing this avenue for conversation, I'm not your medical practitioner. When we discuss all these questions and cases and things there's so much information that we don't have access to. So it's a means of providing you with information, signposting you, encouraging you to, if there's something you're not very clear about, go back and check in with your own registered provider who has all those details and are in a better position to be able to guide you and provide the right treatment. But you're very much welcome. Please share your thoughts, share your experiences in the comments. They'll be very much welcome. So of course, don't forget to give this video a like. That will be so much appreciated. And like I said, share it with a friend. Please check out the description box in the video for the video when we finished, especially on YouTube, because I put a lot of information out there. And we've got so many other tools on the website, askawayhealth.org. And of course, if you do want to see a clinician in the UK online, we are partnered with yourgpconsultation.com, who provide private medical services. So please check out those links in the description box. Come and join us, come and ask your questions, and let's take things from there. So let us move on to the very first question. I'm going to share it on my screen so you can have a look at it. Or before I do that, let us see. Ms. Moore is saying weather is G. Weather is G. You have to finish that thought. Now you've got us curious. Weather is good, I hope. Weather is great. So let us know, Ms. Moore, what is the weather like in Toronto? Okay, but let us go ahead and for you guys on Facebook, LinkedIn, and YouTube, you're going to see the question on the screen. Not that one. this one. But for my friends on TikTok, my lovelies on TikTok, I'm going to read out the question. And please, if you've got a question, shout out. If you've got a comment, pop it in the live so that we can hear from you as well. So here's the first question that we're going to be tackling. It says, hello, doctor. I am 12 weeks pregnant with a big intramural posterior fibroid of 6 centimeters. I've got a very creaky chair. Please try and ignore it. If you hear creaking in the room, it's my chair. It needs oiling. Anyway, hello, doctor. I'm 12 weeks pregnant with a big intramural posterior fibroid of 6 centimeters. My placenta is anterior. The doctor said fibroids are a challenge, but the fact that mine is intramural and away from the placenta makes the situation a bit better. Is that true? So that's the question that we have, guys. That's everything that we have. So no more, nothing else really in terms of information background, but I think she's giving us a reasonable amount just to chip in a few thoughts, and that is all I'm chipping in. It's just a few thoughts that would help us think around the issues with this. And I know there are lots of women who are pregnant or contemplating pregnancy and have fibroids and are wondering how is it going to go? What does it look like? My friends on TikTok, I promise I'm not ignoring you. So nice to see you guys. Once I sort of go into this particular topic and conversation and we've stuck in for a bit, then I'll come and say hi to everybody on the platform. So let's get started. I thought the best way to start things off was to demonstrate to you what these things look like. So, what is an anterior placenta? What's an intramural fibroid? Those are the key things I thought. So let me share my screen so that you can see that along with me. I hope that you're able to see this. So I'm not 100% sure. Let me just double check that you can see. No, you can't. So hang on. Okay, so hopefully, do you know what? Let me just check on my phone that you can see. Ooh, calm down. Don't be too noisy. Let me see what you guys can see. Yes, okay, so the screen, you can see my shared screen. That's lovely. So what you guys are seeing on this screen, first of all, is obviously a baby in the womb and how the placenta can appear. So this first issue that we're discussing today is around an anterior placenta and fibroid. And you've heard about the details. We're told that this is a 12-week pregnancy. So she's in her first 13 weeks. So she's about to round up her first trimester. And at this point, the bump is maybe slightly beginning to show, especially in, slim, trim, thinner women. And you can start to tell that there's something going on. So it's not a very large womb at this point. Some say the size of a plum or a lime, so not very big. But she also has a 6 centimeter fibroid. So let's talk about the placenta. The placenta is an organ that develops as the baby develops, and it's essential. The reason it's there is to provide nourishment or nutrients to the baby through blood vessels within the placenta. It's basically a sponge of tissue with blood vessels, very, very rich in blood vessels that are collecting nutrients from the mom and then taking, waste from the baby into the mom's circulation for the mom, or into the mom's body for the mom to get rid of it. That's generally, the placenta is sort of that path or that sort of bridge. I don't know if that's a good way to describe it, between the mom and baby. That's the placenta. So the placenta can attach itself anywhere in the womb, and what you're looking at on my screen are different possible ways the placenta can attach itself. More commonly, we have the posterior placenta. That's the one, that's number 2 on that you're looking at now, and I hope my cursor is showing. I don't want to make any mark yet, but that's the posterior placenta, which is when the placenta is situated beside the mom, so towards beside the mom's spine. So I'll say closer to the back of the mom. That's why it's called posterior. So it's to the back of the mom, nearer the mom's spine. Different from the anterior placenta, which is the first figure that you can see on the diagram, where the placenta itself is attaching in front of the mom's womb. So it is you'd actually encounter the placenta before you reach the baby. For a posterior placenta, the baby is in front while the placenta is behind. So the placenta is closer to the mom's back of the mom's spine. But you have, like I said, the placenta can attach anywhere in the womb. It can attach at the very top, in which case it's called the fundal placenta. So guys that are watching on YouTube, Facebook, and LinkedIn, you can see my cursor look at over the third image, and that's the fundal placenta because it's about the top, underneath the mom's breasts. So that's the fundus of the womb. And then you can have one that is opposite that, and that's called a low-lying placenta, and that is one that we take very, very seriously. Because of the potential complications it can cause and lead to something called placenta previa that you will hear in your pregnancy journey. You would hear about this, you read about it, and so on. But that is where the placenta is lying close to the opening of the womb, or actually covers the opening of the womb, and that can create lots of problems. So I thought this was a useful diagram just to sort of orient us in terms of when we talk about an anterior placenta, what are we referring to? So let's switch to the next image, and that sort of pulls it into better view. So you're now looking at an image that shows the anterior placenta and the posterior placenta. And you can see how in the posterior placenta, the placenta is situated right close to the mom's back towards her spine, while in the anterior, it's situated in her front, right in front of her tummy. So that's the difference. Is the anterior placenta a serious medical condition or problem? So it's not a serious condition or a life-threatening condition that we think, oh, if you have an anterior placenta, it's, serious, but it's one that's important for your doctor, your medical team to always keep track of. So when they tell you, oh, you've got an anterior placenta, one of the things it means is that they're going to probably be seeing you a lot more sooner. You're going to be having more frequent scans because they want to keep track of how your baby is growing and how the placenta is growing and so on. What does it really imply? So it could imply, when you go to have your antenatal check, and we're trying to listen to the baby's heart, or even you sitting at home, just, as your pregnancy grows, you might find that you feel baby's movements or baby's kicks a bit less because the placenta is in front. And so it's like a sponge and it dampens. It's not that baby isn't doing it, baby is kicking, but the presence of the placenta right in front sort of dampens the movements, and you don't feel them as well as you would have if the placenta was behind. So that's one thing that you might experience with an anterior placenta. And it might make it a bit tricky when we're trying to monitor the baby. If you go and the midwife is trying to listen, or we're trying to use a Doppler to listen to the baby, because the placenta is covering the front, we can't get to the baby directly. And in some cases, and that's why we monitor, it might move across. You can see how it's positioned here. In some cases, it might move across and travel down towards the bottom, close to the os, when we get concerned, because then it has become a low-lying placenta. It could lead to placenta previa. So these are the reasons why the placenta is, if you have an anterior placenta, why it's monitored. So it's something that it can happen in, I think it says about 20 to 25% of women it can develop. Nothing to make you panic. It's not a complication. You shouldn't worry about it. But it's good to be aware that it could cause certain issues if not properly monitored, and your medical team will definitely be handling that. Okay, so I think we should move on from the placenta, because I think that you clearly understand this is what a placenta and what an anterior placenta. That's why I've spent the last couple of minutes trying to define that clearly for you so you understand the difference. So let's move on to the next issue at hand, which is now the fibroid. Many of you who are OGs on the channel will now have talked about fibroids, so I know that you'll understand different types of fibroids. But for anybody who's new, anybody who's joining us fresh, who's a virgin to the channel and hasn't come across our videos, I'm just kidding. Of course, fibroids, we know, are benign growths that develop from the womb. We know that fibroids can grow in 3 different planes. I'm not going to go into too much definition. If you want to learn about fibroids, I've got 2 playlists. I've got several videos. We've defined fibroids. But today we're looking at the position, because that's what's relevant. This question, she says she's got a posterior intramural fibroid. Let's break that down. So like I said, the fibroids can happen in 3 different levels. The womb, the lining of the womb itself, the wall of the womb is divided into 3, is what I'm trying to get out. Okay, so you have the outer covering of the womb. So it's like a, like a layer. And you have the middle or middle layer, which is the muscle of the womb. And you have the inner layer. Those are the three linings. And so you have fibroids that can develop coming from the womb, but that are positioned in such a way that they carry the names of those three layers. So the first one is the submucosal, that is from the inner lining of the womb where the baby sits in. And if you're looking at my diagram, if you can see the one I've got in front where my cursor is, this is a submucosal fibroid, because as you can see, it's developing from the muscle, but it's growing into the inner lining of the womb. So that's one. Then you have the intramural, which is where my cursor is now, where the fibroid is sitting right inside the muscle. That is the middle layer. Or you can have the subserosal, where it is jutting from the muscle outside of the womb, so going into the pelvic cavity. So you can have a fibroid, you can have other pedunculated fibroids and so on, but these are the three sort of main areas where the fibroid could position itself depending on the direction which it's growing. So it's either sitting inside the muscle, or it's jutting into the cavity of the womb, or it's jutting outside the womb cavity. This one that we're dealing with today is the intramural. So it's sitting inside the muscle of the womb. We're told that it's 6 centimeters, and we're told that it is posterior. So what does that mean? Let's move to my next image. And let me just check that you can still see that. Okay. So I think you can still see my description. So this intramural, and I want to draw on this thing. I don't know if this will work. Let me see if it will work. Okay, so anterior placenta. Remember the definition of anterior placenta? It is one where the placenta has attached in front of the womb. So it's not in the more common sort of posterior back of the womb, closer to the mom's back, or at the top or at the bottom. Is in front of the baby. Okay, and that's what you can see here. Now, the fibroid is the one that is not on this picture. So we're going to, please use your imagination. This is not to scale, it's just for demonstration. So we have a fibroid. Posterior means back. And she said to us that it's in the muscle. So we have a fibroid that is located, if you can see my cursor, somewhere here. She said it's 6 centimeters. Again, guys, nothing is to scale here, and I'm not a very good artist. Please just use your imagination. So there's a fibroid that is 6 centimeters, sort of sitting there, and her placenta is here. So this is the situation that we have. Okay, there's the fibroid. I've colored that in blue. Opposite, so the placenta is anterior, fibroid is posterior, but it's there. So you have to think, what are the potential issues? That's what we need to address. And how can we reassure ourselves? First of all, I'm really very happy. I think I can stop sharing this now. I think, because I just wanted to make sure that everybody was on top of so let's just chat. So first of all, I'm just really very happy that her doctor is very, reassuring. He said, fibroids are a challenge, but the fact that mine is intramural and away from the placenta makes the situation a bit better. And so she's wanting some clarification. And I'm really glad that the doctor is being very, I think they're giving her the facts, and they're also being reassuring. And I would, to a large extent, agree that this is a good place to be. We usually have, many women with fibroids have babies without any problems, no complications. So fibroids, the fact that you have fibroids does not mean that you should be afraid of getting pregnant. Many women with fibroids have very natural pregnancies and births. Some don't even know they have fibroids, and they don't have any issues with getting pregnant. But let's sort of look at potential issues. The doctor said that it might be a challenge, but that the position of her fibroid and the fact that the placenta is anterior, they are going to manage it. And I think that's the critical thing, is about managing the issues. Okay, so the fact that the fibroid is 6 centimeters, that's a significant size. So that's not a tiny fibroid. It is I don't have any of my fruits. I usually use to show you guys. So that's about sort of half the size of my finger. So that's not a tiny fibroid. Tiny fibroids, we're saying 1 centimeter. This is 6 centimeters. So it's a significant fibroid size. Intramural, to me, is reassuring, and generally is reassuring, because it's not jutting into the the cavity, the womb space where the baby is going to grow. Now, that said, though, the fibroid potentially can still grow. There's potential for the fibroid to grow. But guess what? It's not, we can't always predict it, because sometimes fibroids shrink in pregnancy, especially when you get to the 3rd trimester. So it's possible that could happen. The fibroid could shrink at some point. But let's bear it in mind that one of the issues that could happen is that the fibroids could grow bigger. And then we just saw from the pictures I shared, when I sort of did my little diagram, that the fibroid is sitting at the back, so by the mom's spine. I think that's the better way to express it, instead of at the front. Okay, because that's where the placenta is. So the fibroid and the placenta are not exactly in the same location, but let's bear in mind that the baby is going to grow, placenta is going to grow, fibroid potentially could grow, but in some cases it might shrink. So these are key things to be aware of. I'm surprised that they were giving sort of a placenta description, but I think it's very good at 12 weeks. I think this is just one of my first times of being aware of it at this stage, because clearly you're going to have follow-up scans. But I think it's even better that you get this information early, because at this point you need to be having frequent scans. So what are the possible things that could happen? And not necessarily in your pregnancy. It could happen at anyone who has fibroids in pregnancy. One of them is pain because of the fibroid. Sometimes because of the increased blood supply, the fibroid grows very, very quickly. It grows so quickly, it manages to overgrow its blood supply, the blood supply to itself, to its tissues. And when that happens, those tissues then start to get starved of nutrients, and that can lead to pain and breakdown of the fibroid. Something called red degeneration is what you might see if you're reading up about this subject. But the key thing is that it can cause a lot of pain, and so you might need to have extra painkillers. Just being aware that this might happen is something that's really important to be aware of. Thanks to guys liking the video. I really appreciate it on TikTok. I will take a minute, I will take a break very soon and then acknowledge you guys, but thank you so much. And if you're watching on YouTube, Facebook and LinkedIn, please do say, drop a comment or drop a chat or like the video. That would be much appreciated. Okay, we've talked about the fibroid growing, so of course there's a potential, even though it is sitting in the wall, even though it's not inside the cavity with the baby, of course there's a chance that it can grow. And so as it grows, fibroids could grow to very large sizes. It might also compress the space where the baby is supposed to, where the womb is supposed to be expanding as it accommodates the baby. Some other things that can happen simply because the fibroid is there is it can lead to preterm labor, simply because the fibroid is distorting the normal womb architecture, and so it causes the muscle or causes the tissues to be irritated, and they start contracting before baby's ready. If the fibroid grows in such a way that it manages to prevent the baby from positioning itself properly as you get towards your 3rd trimester, it might create a problem in terms of not a standard vaginal delivery, increasing the risk of the chance of a C-section if the fibroid happens to prevent easy access to the birth canal. So these are some of the issues that could be considered. And these are the reasons why we need frequent monitoring. So please don't be frightened. Please don't worry. This is something that now that it's been picked up early, there are ways to get around any issues that might present. In terms of the placenta, I mentioned how it could make monitoring of the baby's heart a little bit tricky, especially depending on where it's located around the front, or if it sort of goes down a bit lower. Those are the issues that your doctor will need to be aware of. So what it means is that you're getting frequent ultrasound scans, and your doctor will discuss this with you. They probably want to see you every 4 weeks, and as your due date comes 2 to 4 weeks, they might decide early on, depending on how things present, that it is a C-section. That might be the decision that you're provided with. So that might be something that you get to hear, something to keep track of. So these ultrasound scans that you're having are to track the growth of the fibroid. Is it growing or is it shrinking? To track the position of the placenta, to track the size of the baby's growth as well. And, these are the key things that they'll be looking for in those ultrasound scans. You need to be aware about pain because, of the fibroid. Some people say that women with anterior placenta, there is there's some literature that indicates that they tend to experience more pain around their pelvis or their bump, lower part of the bump. Some may have more back pain. With fibroids, of course, there could be pain in the back for some women. So being aware of these symptoms and reporting them to your doctor, don't just ignore them, report them to your doctor. And of course, be aware of the potential for bleeding. Any type of bleeding, of course, should be reported to your medical team. The fact that contractions could happen, again, that's something that should be discussed. Changes to your baby movement, I would always I recommend you have a conversation with your doctor or your midwife, okay? Because in the absence of the anterior placenta, so if you had a posterior placenta, for example, we would say how many baby movements or how many kicks that you'd expect to feel in a particular period, especially when you get well into your second trimester. You may not have that kind of luxury. You may not feel that frequent kicks because of the anterior placenta. So if you have any concerns, please discuss that with your doctor. They would arrange a scan to check the baby's movements and so on. All right, so these are the issues. And the question, if we go back to the question that we are presented with, was, her doctor said fibroids are a challenge. That is true, they can be a challenge, but the fact that mine is intramural and away from the placenta makes the situation a bit better. So a bit better, I would agree, in the sense that it's not in the within the womb cavity. Those can still be managed, but they could cause complications. We don't know whether it's the only fibroid that you have, which case, yes, having just the one fibroid to deal with is better than many. So I would say that there is nothing to be afraid of. Please don't panic. The issues I have talked about are the main issues, and I'm pretty sure that your doctor, your midwife, will have further conversations with you. And if they don't, open up and say to them, what things are they thinking about? What are they concerned about? What are they preparing for? Is how I would have that conversation with your medical team. But I think you're going to do absolutely fine. You're going to have a lovely, smooth pregnancy. Just keep on top of your symptoms, speak to your doctor, your nurse, every time that you need to, have pain medicine, simple paracetamol, have it handy at home so that if you need it, you can get to it. If you experience back pain, perhaps simple things like water bottle or, simple home cares like that could help. Have those straight to hand in the first instance. If you're really struggling, then contact your team, contact the clinic, go to the emergency department. Sometimes when you have that degeneration or breakdown of the fibroid, that pain can be really, really bad, and it might need a visit to the emergency room. I'm not saying that's going to happen. I'm just providing as much context as possible. And of course, in that case, there will be very, very good, stronger painkillers that will be available for that. So I think one other question that will be of interest is can you give birth vaginally? That is possible. It all depends on how your pregnancy progresses. Let's not preempt it. It's still very possible, and that's why you're being monitored. It is when it gets to a stage where your team feel, no, it would not be safe to proceed with the vaginal birth, that they will let you. And that will be, you have a good amount of time, because it's already in the back of people's head that, wow, this could happen. That is why you're having regular monitoring. So some women could deliver vaginally, depending on how, the fibroid grows, how the placenta moves, and so on. So I can't say yes or no, it is possible, but a C-section birth is also possible if it's planned and handled with expertise, as I would expect. Then like I said, I believe that you guys are going to be fine. So I'm going to share this video, or this segment of the video, with the lady who sent in this question. I don't know if you guys on TikTok or YouTube, Facebook, LinkedIn have any comments. Let me now have a look at the comments and see what you guys think. But let me just thank somebody has been releasing likes and loves, and it's amazing Amma Gold. Like the live. Thank you so much. I'm trying to scroll right to the top because you've been doing this for a while. So hi, Amazing Amma Gold. Let me shout out to you. Thank you so much for joining the live. I appreciate you, and thank you so much for the love that you're showing. Much appreciated. So let me see if there's any specific question coming up here before I look at my guys on Facebook, YouTube, LinkedIn. Thank you so much. I appreciate that. Thank you so much. Amazing, Amma Gold. Okay, so hello to you guys on hi to you guys on YouTube. Okay, so it's more picked up on my joke. I was just pulling your leg. She said the weather is great, very hot today. Okay, yeah, I know how that feels. And here is Monsieur Roman saying, hi, Dr. Sylvia. How are you from Facebook? Hey, how are you? I'm doing well. Thank you so much for asking. I'm doing good, and you're very much welcome. I hope this is of interest. But anyway, yeah, that was the first question. And I've sort of shared my thoughts around it. Thank you so much for posting the question. You guys know I love hearing from you. Usually the questions I address usually come from people on YouTube. And from time to time, I get questions that I think it's a good idea to share on a platform like this. So I don't just respond. I use that question to come onto a live and have a conversation around it. But again, please don't forget that what we're doing is providing general information and directing you to your doctor for any clarifications that you might need, not any specific advice. Please speak to your own medical practitioner. All right, question 1 done. Good. Let us take a quick break, my people on Facebook, LinkedIn, and YouTube. And yes, I will come back to you in a second if I can just find my promo video. Yeah. Feeling unwell or dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today. At yourgpconsultation.com, and if you're UK based and you're looking for an online private general practitioner, we provide advice or we provide guidance and treatment for UK based individuals, people living in the United Kingdom, and on different areas: women's health, sexual health, mental health, general medical advice. Please book a consultation today. Right, so let's get on to the second question. And this one, like I said at the beginning, so this one is less, less explanation. It requires less explanation in terms of medical issues, but there's a little bit. I think what is more concern really is the ethics and the professionalism of this. So let me read it out. Guys on Facebook, YouTube, and LinkedIn can already see the comment on the screen. But guys on TikTok, let me read this out to you guys. So I received this in my comment section. I did a fat shaming video it's been a few months, I think a couple of years actually. That video is not a new one. But I think somebody was so disturbed, they came looking for the subject and they stumbled on that video. So this person said, I've just had a visit with an internist to determine if I could get surgery for endometrial cancer. The internist told me he hoped it was a wake-up call for me to lose weight, that my obesity was the reason I had cancer, and if I didn't lose weight, I would continue to develop new cancers. I'm here to determine if that was fat shaming or just a doctor doing their job. I feel like dirt though, and I've been crying for 2 days. So, when I saw this, I was really very disturbed. I think that's not a doctor doing their job. So I can answer the question straight off, without even going into detail. That's really horrendous, because the fact that you left the clinic or you left the conversation and you've been crying for the last couple of days suggests the impact of that interaction. That is definitely not how a doctor with our training is supposed to provide guidance or support or medical or healthcare, quality healthcare, which all of us are entitled to. It's not a privilege. Good quality healthcare is a basic, human right, and I don't think you are appropriately treated. So let's look at the ins and outs. You guys, I know that my videos are watched right around the world. I know you guys know I'm a UK trained, UK trained and UK based doctor. So when I saw internist, an internist is an internal medical physician, and they're having a conversation about surgical treatment. So I thought that was a bit of a puzzle. And I'm not trying to excuse a doctor, because a basic just graduated doctor, you do have, we do have lectures, we do have encounters where the safety of your patient, the way you interact with your patient are crucial, really important. So I'm not going to absolve them of blame because they're not a gynecologist, but I felt that this is a conversation that somebody should really be having with their gynecologist. That's the first thing. So I thought it was a bit unusual. What's the role of the internist in this conversation? Because here in the United Kingdom, somebody, if they present with symptoms, they'll present to their GP initially with symptoms. That's sort of a typical route. With symptoms, for example, irregular menstrual bleeding, postmenopausal bleeding, for example, and then the GP refers on to the gynecologist. And so the management or the care sort of sits with the gynecologist or the gynecological oncologist. They get the cancer doctors, or they have a multidisciplinary team or approach to the care of such a person. So hardly will the internist come into it unless there's something else that, they want a consult from the internist, maybe somebody who has diabetes as well, or they have thyroid problems. I'm just sort of thinking, if you guys have any sort of thoughts around this, maybe there's a medic who's watching this as well, and you're working in the US, please feel free, shed some light on it for me. But that was sort of the first thing. However, let's go specifically to the things I found very, very problematic with this statement or with this interaction. So you saying to somebody that, it's a wake. First of all, the person came to you because they wanted to discuss treatment for cancer. This person is already dealing with a lot. They're already dealing with, cancer. And this is a very vulnerable situation. And here they are. I presume this is at maybe the beginning of the treatment journey, or whichever stage of the treatment journey. I was going to say perhaps this is news that they're still coming to terms with. But even if you were in the middle or you've had some treatment for some time, it's still a heavy load to carry. And so one should be speaking with sensitivity and professionalism. And for a clinician to say, well, Mrs. So-and-so, I hope this is a wake-up call for you to lose weight. That's wrong. I don't know if that's how they said it, but I don't know how else to assume that somebody would sort of have this cocky approach to say, that's not the time. There's a time and there's a place and there's a way to say things to people. If you think that you want to help to instruct them, if I were to sort of bend over backwards and look at a good way to paint this clinician's behavior, I would say, well, there's a place and there's a time and there's a way. But it's certainly not at this instance where somebody is carrying this load and they've come to you to say, how can I get better? So it's absolutely wrong to say, I hope it's a wake-up call for them to lose weight. And then the next thing, and the next problematic statement I felt is when they said, sorry, something happened to my, sorry guys, something just happened to my, hold on. Yes, I think I clicked the wrong button. And so the next problematic thing I thought was when they said, that it's because of the obesity that she ended up with endometrial cancer. And because you can't, we know that there is a risk between obesity and endometrial cancer. There is a link that we know that being obese increases the risk of endometrial cancer. But guess what? Not everybody who is obese develops endometrial cancer. So for you to sit down and attribute her developing this cancer to her weight, whether you're trying to use that as a stick to beat over her head, to push her to lose weight immediately, you shouldn't, that's an inaccurate statement. It's not based in fact. So I have a big problem with that statement being inaccurate, as well as being inappropriate. You can't say that. There are many other factors we know, environment, genes, they all weigh in, and we know it's multifactorial. So you can't just get up and say, oh, it's because of the weight. And of course, the other statement, as if those two weren't enough, saying a wake-up call or saying that obesity caused her cancer. The other point was that, if she doesn't lose weight because of that obesity, she's going to go ahead to develop more cancers. That again is another insensitive, again, less than accurate statement, because people who are overweight, not all of them go ahead to develop different types of cancers. Now, of course, it is well within the role, and it is appropriate of a doctor to say to somebody who is overweight, to provide them with guidance about losing weight, because we know that being overweight is associated with a host of different medical problems. We know that. And yes, it is within the doctor's, within the education, what's the word now? The education role of the doctor, the preventive health and public health education of any doctor, to say, if we recognize that there are certain risk factors that you're dealing with, we should say, hey, this is something that could either cause problems or could lead to this. How are you getting on? What do you think about this? What are the challenges? So we're providing a way to help you achieve a goal, which is to lose weight. Do I support that perhaps this person needs to lose weight? Yes, because I think they'll probably feel healthier. They might feel better. Don't forget, I don't have all the ins and outs, but doing it this way and at this time, that's clearly inappropriate. And that's why I said it's fat shaming, and it is not, the doctor is not supposed to be fat shaming, because they've ended up blaming this person who is in such a fragile state because of their diagnosis. And this is not me trying to baby anybody. This is not me trying to treat them with kid gloves. No, we're all human. Come on, let's behave. We're human beings. Somebody's been told that they have cancer. There's certain things that you would say, and there's certain things that you might think, and you want to keep that away until a particular time when it's more appropriate to say it. You're putting a 2 + 2 = 4 approach to complicated medical conditions where science is still trying to explain. Because if anybody says, what is the cause of endometrial cancer, you wouldn't just get up and say, it's obesity. That's not true. You would say, this condition happens in women. It's more common in women of this age. We see it in certain situations, one of them being obesity. Another one can be different types of hormones. Another one can be, there might be some genetic link to it. So you've just oversimplified a complex medical situation. And then she didn't mention how you guys spoke about her treatment. She came to you because she wanted to discuss surgical treatment. But here we go, we're discussing losing weight. How does that add in with the treatment? Okay, so I'm really concerned about that. Really not very pleased that that kind of conversation is happening. And I'm so sorry. I'm going to share this video segment with you, the person who sent in the question, and I just want to say I'm so sorry that you had to experience that at a time when your things are looking a bit challenging. Not a bit, things are challenging for you, and I hope that you have access to other medical advice, other medical provider. I hope that you have advice to people around you who can sort of help hold you up and support you at this very difficult time. And I'm really happy to take any questions that you want to have to sort of clarify this. It's important that we get respect, whether we're ill, whether we're thin, whether we're big, whether we're black, whether we're white, whether we're this or that or the other. Everyone deserves respectful, evidence-based care, not just me just talking out of my head or using personal anecdotes to talk to somebody about their health. So if you have to correspond with this person again and they go down this track, please, stop them, check them and say, I'd like you to focus on my cancer treatment, please. I don't think, I'm not happy with what you're saying. It's inappropriate for you to speak to me this way. And you can get a different provider. I would suggest that because I think if it were me personally in this as a patient, I would feel like there's a loss of trust. And that's the shame. That's a painful thing when this happens, because people who think that tough love is the way to push people to go forward. Now you've gotten this person who's supposed to try to focus and ginger themselves into cancer treatment. Now they spend the last couple of days crying simply because of this approach that you used to talk to them about weight loss. How about letting them, having a conversation about the different cancer treatments and helping them to decide which one to go forward? And then you can have, maybe at the next visit or subsequent time, you can have a conversation about holistic care. What about doing that? Because then you can introduce, healthy eating habits and ask them perhaps what are the issues they have around that, issues they have around exercise, or it's not a thing that you can just sort of beat them over the head with. So I feel really strongly about this, and of course I would say you also have the recourse to report this, because I am concerned that not only have they done this to you, perhaps there's a gap in their understanding about what they're doing. I don't know. And then, of course, could this happen to somebody else? So there is room to sort of bring this up to whoever is in charge, whoever takes complaints in that facility, and say, you've had this experience. Not because we want to punish anybody. We want to improve. We want to improve the care that is being provided to everyone. We want everybody to have the best care possible. And then again, like I said, in terms of who looks after this kind of situations, gynecology and oncology, the teams that will sort of look after this, especially in the treatment phase. After recovery, then people will sort of go back to their family physician or family practitioner. But of course, there could be certain things or certain situations that develop where you might need a consult from another surgeon or a consult from an internal medicine specialist or physician. So that might be possibly there. So that is very, I think that's my thoughts on this. I don't know what you guys think from TikTok, if you've sort of heard the story, how you feel about it, guys, on YouTube. I felt it was important to share it. And like I said, I will bring it up as I will share this clip from this live with the person who posted the question in the first place. And I hope this provides them with some encouragement. Let me just look through my notes to make sure that I've not missed anything. So yeah, focus on her health, not just her weight. The weight is important, but focus on the overall well-being. Be compassionate, empathetic, starting with how you're coping, how is it, start the conversation, not with this is your wake-up call. Honestly, this is it's really troubling, to have this, to learn this kind of situation. I almost wish that this is like, somebody's just sort of having me on and that this didn't happen. I'd really be happy if you send me a message and said, oh, doctor, I was just pulling your leg, because it sounds almost unbelievable, but I want to tackle it just in case somebody's experiencing that. So yeah, I think that's everything. Referring to the right person, not being afraid to request for a second opinion or to be referred to somebody else, to be able to speak up for yourself. You wanted to know whether this was fat shaming. Well, yes, it is fat shaming. I can categorically tell you that, because it's blaming you for something, and it's related to your health. It's not empowering you or giving you the tools that you need to actually make positive change, and it's left you feeling mentally lower, especially at a time when you were already low. Our worth is not defined by our weight. Yes, we know that being overweight is associated with health problems, and yes, I would encourage you to lose weight, because it would help you reach your health goals better, get to a healthier state. We know that. And again, she didn't tell us how overweight she is. We don't know. She mentioned being obese. So it's likely that losing some weight will be helpful to your heart, to your joints, your kidneys, reduce the risk of developing diabetes. Being overweight has been implicated in lots of different cancers. That is true. And as a medical professional, yes, it's my responsibility to discuss those kind of risks with you and say, these are the issues. What challenges do you have with your weight? And then look at how we can best support you. Okay, this is where I'm going to, this is where I'm going to close it for today. Especially because my TikTok phone is low on battery. Guys on TikTok, thank you so much. I really appreciate the support. Amazing Magold has left, but she was an amazing person. She was really amazing. She stuck to her name. Thank you so much for joining me from the UK. I really appreciate that. And thank you to everybody who's joined. I hope you found this very, very useful. I'm just going to close the live here if I can remember how to do it. Thank you so much for watching, and I will see you guys on TikTok again real soon. Bye. All right, guys, on YouTube, Facebook, and LinkedIn, thank you so much for joining. Please don't forget to give the video a like. I usually do lives on Sunday afternoons and evenings like this. It's just been quite busy recently, but since I'm here, let me announce, and I'm going to be sharing it on our community post. I'll let you guys know that that we're having a special session next week, Sunday. We have an esthetician who's coming to join the conversation. And we have lots of questions to ask from Dr. Naren when he comes in, and he's going to talk to us about, what are the happening things? What are the things that he's seeing? What is it that his patients are talking about when it comes to boosting appearance, skin care? What kind of treatments does he have in his practice? I think if you're interested in having that conversation, please come and join me. I will put I think I'll put the advert, if not today, then tomorrow or before the middle of the week, so that you can join in. And if you've got any questions, anything that's sort of burning on your mind, if there are any procedures that you've been thinking of getting, treatments for the face, or other types of treatments, please come and ask them, because we have 60 minutes with an esthetician, an aesthetic specialist. He's also a GP. But, this is I think it's a real opportunity to get your questions asked. All right, guys, thank you so much for watching. I really appreciate it. I hope you have a great rest of the week, and I will see you. Don't forget to check out the video I published this afternoon on, I'm doing these Q&A shorts now. What's this one about? Oh, yes, it's about recurrent pregnancy loss, because I think it's a question that people ask, why does this happen? And I just picked up that and put a shot together. Check it out. Let me know what you think. And then there's another video coming out later on in the week. And I'll see you again on Sunday. Take care, guys. Bye. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today.